Welcome to video 5 of the series. We're now going to look at results measurement plans, another tab in the intervention guide which we've been explaining in the last couple of videos. Now we're going to look at measurement in a bit more depth. In the last video, we looked at how you develop a results chain and how you agree it within a group. And so now we need to talk about how you measure it once implementation has started. The DCED standard requires you to set an indicator for every box in the results chain. This will specify exactly what data you need to collect to measure each step. You can't just collect quantitative numbers, you also need to collect qualitative information, because this can help you tell the story of how the changes you're observing are happening and why they're happening. You need to say exactly how you will collect this data, what methods you'll use, and also who is responsible, when they will do it, and so on. Here's an example. You probably remember this jute example from the previous video. Jute is a natural fibre grown in many countries, and the intervention aimed to support farmers by partnering with a company called Jute. So one indicator you would look at is the net additional income received by farmers. And another indicator, for example, might be the net additional income received by female workers. This is a common DCED indicator, recommended to be used where appropriate, because it allows you to assess the extent of the benefit to the target group. In terms of qualitative data, you might look at why farmers increased their income. What's their perspective on this change? How is the income being used? Of course, the qualitative data you collect might vary significantly according to the program, in your context, and your interests. So how do you collect this? Potentially a survey of farmers supplemented by in-depth interviews. And you need to look at the kind of logistics of how this is collected. So here we say a baseline is conducted. A baseline is really important to measure any change, and then followed up a year later. So here's an example of how for every box in the results chain, the measurement plan should unpack that box, showing not just what the change is, but how it's going to be measured. This is quite a lot of information, so it's normally put in a table format like this, where the box from the results chain goes on the left-hand side, and then for each box you say, what are the indicators, what qualitative data, and how do you measure it? A few tips is firstly not to put in too much information. You're not writing an essay, but you're trying to, especially at the beginning, just give the outline of how measurement happens. When you actually come to do the survey, you will of course need to answer a lot more questions about what sample, how do you find them, what kind of questionnaire do you use, but normally when you come to the survey, you'll develop a separate research plan, which we're going to look at in a subsequent video. A second tip is that although you might end up with lots of different measurement kind of rows because you have lots of boxes in the results chain, often you do one measurement exercise to collect multiple indicators. So for example, you will do, let's say you do one survey with farmers, and this looks at their change in practice, it looks at their income, it looks at their engagement with Jute. So it's not the case that every box in the results chain needs a separate measurement technique. We mentioned baselines before, so I wanted to briefly return to the topic here. This picture depicts a common problem. Programs do a big baseline survey at the beginning of their project, and then find that they can't use any of the findings. And this happens for two main reasons. Either the baseline survey did not collect the right information, because programs did it before they put together their results chains and indicators. And sometimes the baseline survey didn't ask the right people because it was too early in the intervention to know who their target group were. So traditional big baselines at the beginning of a program work very well if you have a stable program where the theory of change has already been tested and is not going to change. But if you're experimenting, trying new ideas, you will need to wait until you've selected your target group and finalized your intervention before doing your baseline. A good mantra is to wait as long as possible before doing your baseline and then do it as quickly as possible. Another question the DCED standard asks you to grapple with is the question of attribution. And this is the question of to what extent were the changes you measure really due to your project? Attribution is often quite a scary step for programs. People worry about it a lot. But the DCED standard encourages a practical approach. It encourages you to do what you can with the resources you have. So it doesn't require a specific method for assessing attribution. Many people use control groups, but you don't have to use a control group. You just need to think about it and come up with a plausible story for how you have created these changes, backed up by the available evidence and challenged by the evidence as well. I think when you use the DCED standard properly, the question is not so much do you use a technique or do you not, but are you thinking about it in the right way? Are you being appropriately critical of your intervention? And one essential step is to use the results chain to look at attribution, because the results chain breaks the overall attribution question of did your activities lead to the impact into smaller, more answerable questions. For example, at every stage you need to say, did the expected change happen? Did the lower box contribute to the change at the higher level? What other explanations are there for this change? And if you can look at that for every level of the results chain, you build up a plausible story of how you've contributed to the impact. As a very brief introduction to measurement, you can find a lot more guidance on our website, including case studies of measurement techniques and specific guidance on the kind of measurement approaches that might be appropriate.